Hello, this is Dr. Greg McGrew, and I want to congratulate you on being fitted with contact lenses for the very first time. Contact lenses are a great alternative to glasses, and we want you to have clear and comfortable vision with your contact lenses for many years to come. And that's why we have this video here for you, to reinforce the techniques we've taught you for care and handling of your contact lenses. Now, contact lenses are very safe, but precautions do have to be taken to avoid complications. Sleeping in your contact lenses, not throwing them away when you're supposed to, improper cleaning and storage of your lenses, these things increase your risk of infection, scarring of the eyes, and possibly even vision loss. Now, if you have questions, don't hesitate to give us a call or shoot us an email, and we'll answer them up for you. Now, if you're still struggling a little bit with getting your contacts in your eyes, don't worry about that. It's going to get better with practice. But if you're really having a difficult time, set up a brief appointment with us. We'll watch what you're doing, give you some pointers, and have you as an expert contact lens handler in no time. So go ahead, watch and learn, and keep in mind what I say to patients all the time. If you treat your contact lenses right, they'll treat you right.
So, you've just gotten contact lenses. Nervous about putting them on? Don't be. You'll be amazed how quickly it becomes second nature. Here's a tip. Don't think of it as putting a contact lens in your eye. You're putting it on your eye. You barely touch your eye at all, because the soft lens glides into place as soon as it reaches the surface. And if you're wondering, your lenses can't get lost behind your eyes. They can't get stuck to your eyes, and it's almost impossible for them to fall out on their own. Bottom line, it's easier than you might think. And the more you do it, the easier it gets. Okay, let's get to it. First, always wash and dry your hands before you touch your lenses or your eyes. You definitely don't want dirt or germs on either. Always start with the lens for your right eye, so you don't mix them up, since each eye has its own prescription. Scoop your lens out of the case, then follow the instructions for your lens solution. Making sure your finger's dry, put the lens on the tip and take a close look. If it's shaped like a little bowl with a nice straight edge, you're good. If the edge curves outward, it's inside out. Flip it. Use your lens hand to pull down your lower lid. Using your other hand, hold your upper eyelid. Gently place the lens on your eye. You can put it right on the center of your eye or on the white part just underneath, whichever feels best. When the lens is all the way on your eye, slowly release your upper eyelid and close your eye for a moment. Blink a few times and look around to center the lens. And that's it. One more tip. If you wear makeup, put your contacts on first, so any makeup on your hands doesn't wind up on the lenses. Now do it again with your left eye. Well done. All right, you've had an action-packed day thanks to your new contact lenses. And now, it's time to take them off. Most people think removing contacts is even easier than putting them on. What's the first thing? Right, wash and dry your hands. Prep your lens case with fresh solution. Just like when you put them on, start with your right lens. Look up and pull down your lower eyelid. Bring your index finger close to your eye until you touch the lower edge of the lens. Slide the lens down to the lower right part of your eye. Gently squeeze the lens between your thumb and index finger and remove it. If you're wearing one-day lenses, just toss them out. If you're not, follow your doctor's instructions on how to clean them before putting them in the case. You'll want to replace your contact lens case every 3 months or so. And this is very important. When it's time to switch to a fresh pair of lenses, be sure to stick to the schedule your eye doctor gave you. Over time, the proteins in your tears slowly build up on your contacts. So do dust and pollen. If you wear your lenses longer than you're supposed to, there's no hiding it. Your eyes will look red and tired. They'll be itchy and irritated, and you won't be seeing your best. A fresh lens is a better lens. If you need help keeping track, you can sign up for free reminders from AccuMinder. As always, if you have questions or if you just can't get your lenses to feel right, ask your eye doctor. Even if it takes a little practice at first, putting your lenses on will become routine, and you'll be out and about in no time, looking and feeling great.
You wouldn't drink milk 3 weeks past the expiration. You wouldn't wear the same socks for a week straight, we hope. And those 10-day-old flowers, looking pretty tired. It's a fact of life. Most things are better when they're fresh. That includes your contact lenses. For healthy-looking, comfortable eyes, you've just got to change your contacts when your eye doctor says. A fresh lens is a better lens. But my lenses feel fine, you might say. Can't I save a few bucks and squeeze some extra days out of them? To answer that, let's talk about protein. Not the kind you stir in your shakes. We mean the natural protein in your tears. Over time, that protein accumulates on your contacts, creating a thin haze. Other parts of your tears get stuck as well. But foggy vision's just the start. Eventually, those proteins change form and trick your immune system into thinking the buildup is something foreign. That can lead to eye irritation, itching, and redness. Next, toss in outside stuff like dust and pollen. And even when you take perfect care of your contacts, they slowly get less smooth and clear. It may sound scary, but it's normal wear and tear. Change your lenses on time and you may never notice a thing. Wear them on and on though, and there's no hiding it. People may wonder why your eyes look red and tired. Your eyes might feel itchy and irritated, and you won't be seeing your best. So stick to the schedule your eye doctor gave you. If you need help keeping track, you can sign up for free reminders from AccuMinder. Bottom line, it's worth it. Brand new contacts feel great, and it's the easiest, best way to keep your eyes and yourself looking and feeling bright, fresh, and healthy. Fresh is better.